Okay, hi. So I'm an advanced practice psychiatric pharmacist. I'm the founder of TherapyWorks.tv. We're 100% concierge, cash-based telepsychiatry practice. So let me start off by asking a question. Why is healthcare so expensive? Top three. Anyone? What is it? Bureaucracy, yes. That's one of them. So one of the things, if you're cash-based, is we kind of have to look at how to make things more cost-effective for the patient. So we're going to look at that. Also, we're going to describe our practice, our referral system, intake follow-up, documentation of encounters, and then I'll field any questions that you guys have. All right. So as mentioned, so our practice is 100% telehealth. We have an office in Los Angeles, mostly for our psychiatrists, and we need that for regulatory reasons, but we don't see patients in the office. In doing so, we reduce cost a lot. Our focus is really on delivering high-quality psychiatric med management. We don't really provide therapy except supportive psychotherapy, which goes along with med management. So we're really very, very focused. Our clinicians consist of psychiatrists and advanced practice psychiatric pharmacists, which you folks may not be familiar with, but in California there was a new bill passed. So our pharmacists are board specialists in psychiatric med management. We keep a very low patient volume. So some practices might have a panel of several thousand patients. Ours are a few hundred per clinician. And this allows us to really be available to patients, help them recover more quickly, return to school, return to their job, and so forth. So recruitment. One important thing about healthcare is not something people want to pay for, right? They like to pay for dinner, pay for their car, clothes, but they don't want to pay for healthcare. So it's kind of a challenge. So our goal basically with marketing is really to increase awareness of our practice. Because I'd been with the state for about 20 years, a lot of patients already knew who I was. A lot of organizations did. So I went into private practice. It wasn't so difficult to get patients. And after that, it becomes kind of self-referral. As people learn more about us and the quality of care that we provide, we get more referrals. So our clients are both individuals and then also organizations that provide services for people with both developmental disabilities and along with a mental health disorder on top of it, so they're duly diagnosed. The way that we kind of recruit also is we offer webinars to describe the services we provide. And with the concierge philosophy, it's a little bit different. So again, we're highly available to our patients. You know, while we charge a subscription service, if someone needs us that day, we're there. And thanks to VSee, we can answer a lot of questions and field a lot of questions by text messaging, which in mental health is kind of a no-no, right? You never give out your phone number because you're worried that it's going to be abused. In our experience, it's the opposite. And usually when the patients need us and we help them sooner rather than later, they get better sooner, and therefore they consume less of our time. So it's interesting. So the more we focus on quality of care, the higher our quality of life goes up. Okay, so a big message here is delivery of healthcare does not have to be expensive. It really doesn't. When we looked at what we use, and I researched this a lot, and if you guys want to implement any of this into your practice, I encourage you to speak to a lawyer, make sure everything's HIPAA compliant and so forth. I feel like we did our due diligence though. So we use VSee. VSee has been amazing. Prior to VSee, we used to use Skype. And Skype was fine, except I learned later on that the FBI was actually able to access Skype in an investigation, which means it's not completely private. And thanks to VSee, it's really changed things. And VSee is really cool because not only is it telecommunication, but again, it has that messaging function, which is really great. And Milton's kind enough to make that version of it free. And then regarding scheduling, so I use something called You Can Book Me Now. So patients self-schedule. So once they're signed up for services, they go to our website and they can pick a time slot. Now some patients, so they don't get lost to follow-up, you have to kind of remind them to schedule, or you can schedule for them. But it's very inexpensive. At this point, we've already removed any sort of office staff. We don't need it. And then you'll see some examples of it, but Microsoft Access is actually very robust, and we built our own electronic health record system. And it's HIPAA compliant, it's secured, it's locally based, it's not in the cloud, which adds even more security to you. Then we also have e-prescribing, which we use MetroFax. So when I do my refills, it's very fast. And when I enter new medications, it's very fast. When I was at CHLA, Children's Hospital Los Angeles, we had to use a certain sort of EHR. And it would take several screens just to prescribe one new medication. using something called a grid for database development. Basically, it looks like almost like an Excel table. You can quickly add medications, directions, refills, and so forth in a matter of minutes, rather than taking like 5 or 10 minutes to do refills. So that's very, very efficient, and we don't have to pay for an EHR. Let's see what else. Recurring appointments through Google Calendar. And we use Google, 5 minutes left, okay. And I'll go quickly, I'll just show you guys. So this is a do-it-yourself EHR. So it has all the functionality of a regular EHR, and it's virtually free for us to use. A basic note. And one of the cool things about using something locally is you can use fast keys. So you can type in certain things like paragraphs information, like a mental status examination. You know, I use an apostrophe M, and that types out my mental status, and I can change that very quickly. And the notes are very professional that comes out. And we're able to share a patient's entire record with a neuroclinician with 2 clicks. So again, it's very efficient, saves time, and less boredom for the clinician. And this is what I mean by the medication record. Rather than having to go screen to screen, we can just do it with a simple drop. And that's saving minutes on every patient encounter, and minutes adds up over the course of weeks, months, and years. And prescription. So, like I said, we use MetroFax. So one of the things we like to do for medication reconciliation is we tend to send over the entire prescription. That way the pharmacist can make sure that their records are in line with ours. So it's, again, it's super efficient. A few clicks. Same thing for labs. And here's an example of Google Forms. Again, this is free. And HIPAA, and Google is actually HIPAA compliant. You can get a statement from them as being a partner. So, patients go for their follow-up appointment, and we actually have like a little mini rating scale of what their symptomatology is to see what to focus on during that encounter. Again, it saves time, and it helps the clinician focus on what's going on with the patient at that time. And here's the self-scheduling that patients use. Again, very inexpensive. And any questions?
Thank you so much, Chris.
Sure.
What percentage of your patients are again in the senior, younger, and substance abuse? Is that something you deal with?
Yeah, so again, we have two patient populations. One typically developed, and something happens later in their life, and we follow them, but also through group homes. So this is all ages. So percentage-wise, I think most are probably just in the adult, not senior. Yes.
Hi.
Hi.
Thank you for being here, and I think it's amazing what you've done, because you have shown us that healthcare doesn't have to be stupid, expensive, and complicated. No. And it's really quite extraordinary, because I feel like you could maybe scale this up into different things. Have you thought about that? For example, addiction medicine or something in the psychiatric field, but maybe scaled up to some extent.
Addiction medicine is a little bit difficult. For example, you can't prescribe methadone through telehealth. I mean, there's some limitations. So you'd have to have a partner with the physician or nurse practitioner that's seeing them on a regular basis, so things are possible. And for scaling up, as we add more clinicians, it might come to the point of where we would need, EHR, this cloud-based. But for right now, it's been fine. If we have to share records, we can do it through Dropbox. Yeah.
Can you work in different states?
No, my licensure is here in California.
Okay. So
But here's the cool thing, though, about telehealth, is I could be in Costa Rica seeing patients in California. So it's pretty cool.
Do you handle drug addiction patients?
Some. We were running, for alcohol misuse, we're running an naltrexone clinic for that. But mostly no. Mostly we're seeing folks with a dual diagnosis, being intellectual disability plus a schizophrenia, spectrum disorders, and so forth. Yes?
So when you started out, how did you initially approach your referral sources, therapists, primary care doctors?
Right. So again, for us, the journey is a little bit different because I was already known in the community. My practice was both in Los Angeles and the North Bay area, so I was already kind of known. So the referrals actually came from the agencies themselves to me.
I see. So did you start with telehealth right away, or you had a practice first? And then
It kind of got, initially, no. I mean, initially it was office-based at the various regional centers in California. And then our team psychiatrist, he has some sort of fellowship in Armenia. And so that's when we started doing Skype so he could participate in our team sessions. And then I thought about it, I go, this is pretty cool. So I started seeing some of my patients, in particular parents who have a child with autism and other children, and it's very difficult to transport them to an office. You know, there's a lot of sensory issues, and they may not be able to tolerate waiting in a waiting room. And so I started seeing them. When I left the state, I moved my entire practice to telepsychiatry, and I simply just started calling people I already knew and say, hey, are you looking for someone? Because I realized there was a deficit of mental health providers in the community, especially those folks working with clients that are funded through Medi-Cal. You know, the psychiatrists are underfunded, and so a lot of times, not that they don't, I can't make that statement, but the complaint was, you know, they're spending 5 minutes with my child. They're spending 10 minutes with my child. They don't look
not
up
good
from
care.
the prescription pad.
Yeah.
Yeah, so I knew that there was a need for that. And then the question was, how much are people willing to pay for that without gouging? So we end up with a tiered system based on income, you know. And believe it or not, I mean, one of the complaints I always have is we don't charge enough. But the reality is, how much money does a clinician need to make, you know? So that's our direction.
Thank you.
Yes, my time's up, huh?
I have a lot of questions from my clients. They are saying, like, you know, can you embed VSee system into their EHR system because they don't want to use a different system in parallel. So how do you encourage your team to use so many different platforms?
Oh man, people love VSee. So usually this is the way it works. I'll say, hey, you have to download VSee. They're like, well, how do I download VSee? And then VSee has this really cool thing where you can invite people through email. And once they use it, because people are ready, they like FaceTime, they're familiar with Skype, so it's not a big leap, you know. And the big selling point for VSee, again, is I think in our practice is I'm available. Like if my patient wants to reach me now, I'll respond to them. Because again, I'm under the philosophy that when someone is recovering from mental illness, it's okay to support them, you know, not to the point of where you're gonna have a knee-jerk reaction every time they have a new symptom, you're going to change medications, but just to be present for them, it makes a huge difference. So VSee has really lent itself to that.
Thank you. How about other platforms? You have like several different platforms for your team to use.
We use Microsoft Access, and it is perfect for us. That's all we use. So we have VSee, Microsoft Access, prescriptions, MetroFax. It's very simple. And the website's available. So I think maybe the self-scheduling is something that's actually the more difficult part, is getting people to actually go and schedule their follow-up appointment. So to be honest, about 90% of the time, I end up scheduling my patients again.
Thank you.
Thank you so much, Chris.
Sure.
We love these, you know, physician just DIY and just making things happen. Thank you so much, Chris.